Yeah, I had success with one patient, and then the people that have post-COVID syndrome or are long haulers tend to talk with one another and chat forums and things like that. So I've started to collect people from other states that have this, and I've made some headway with them. And so I've got one patient. I'll just use an example: a 79-year-old woman who I'd seen before, and she's a very youthful 79 and very active, travels, has a full life, probably kind of seemed more like 60. And anyway, so she previously had had some kind of osteoarthritis issues and things like that I'd helped her with. And she was diagnosed with SARS-CoV-2, and then her health just precipitously declined. The infection itself, when she was acutely infected, didn't seem like that big of a deal. And we just thought, oh, it's because you're so healthy going into it, you're going to be fine going forward. And really what ended up happening is that her body became incredibly inflamed. Like every joint that she had a little osteoarthritis in that really wasn't bothering her before became incredibly painful. And she had pain in her knees, pain in her shoulders, pain that just prohibited her from sleeping. And the pain was so intense that she became really anxious. Like it literally was something that she was just on edge all day long. And it was kind of a bizarre situation. And so she was going to orthopedic surgeons to look at her shoulders and getting MRIs, and sure enough there was some pathology in there, but it had been there before and it wasn't bothering her. So it was just this kind of situation that was like her whole body felt inflamed, and then sure enough her inflammatory markers were through the roof. And so it was like there was something causing systemic inflammation in her. And so we ended up having to work with some anti-inflammatory hormone balancing, and that actually put a dent in it. And then I diagnosed some other infections, and I don't know if these infections were primary to her situation, or if they had been there before, and then the stress of the SARS-CoV-2 infection kind of allowed these to get worse. So for example, we all have been exposed to Epstein-Barr virus in our life, and usually if our immune system is working well, we keep it in a dormant state. So I measured her Epstein-Barr titers, and they were literally astronomical. It was just kind of extraordinary. I was like, wow, okay, so I don't think that's the sole reason why you're inflamed, but I put her actually on a cyclovir, and it helped her dramatically. So treating the reactivation of Epstein-Barr that perhaps occurred because of the stress of the SARS-CoV-2, and then the hormonal imbalances that ensued because of that threw her immune system off and allowed this virus that would previously been dormant to reactivate. Treating the virus in that setting really helped her. And then I diagnosed babesia, which is an infection that's usually transmitted by a tick bite, sometimes by a flea, and treating that was really helpful. And there was an interesting thing that occurred. So I put her on herbs for that, and then this is a particular parasite. It's almost like a relative of malaria. And as many of you have probably heard, there's been some talk out there in the world that hydroxychloroquine, which is traditionally a malaria medication, has some benefit against SARS-CoV-2. Well, it's also been shown that it has benefit against babesia. So it's used for rheumatological conditions, and it has been for years. I've used it, on and off throughout my whole career. So I put her on the hydroxychloroquine for various reasons, but primarily to treat her profound body-wide inflammation and rheumatological issues that had developed, but also because it's good for babesia. And lo and behold, kind of like the combination of all those things, treating the Epstein-Barr, balancing her hormones, and then treating the babesia with herbs and hydroxychloroquine helped her. So she is about 90%, about 85% maybe out of the woods now, feeling grateful. She's sleeping again. She's no longer in pain 24/7. And we were able to get her off the acyclovir. She's held her own off that. So I've started to wonder, if these long haulers, have a lot more going on than meets the eye. And I encourage doctors around the country to really take a broad look at people's health that have this going on, and certainly, balance their hormones. I also work with proteolytic enzymes because they chew up the inflammation in the system, and then look for other infections that could emerge within the stress of the situation. And consider the possibility, just consider it, that this is not post-COVID, but potentially an ongoing, underlying, low-grade level of COVID still in their system. And I don't know that we have a way to check for that. I don't know that we have a way to test that. But regardless, in addition to vaccines, we need to be pursuing therapeutics, because I think there's a huge need for that.